And reporting there are COVID variants that are spreading rapidly worldwide, and scientists and doctors are just trying to keep up.
Yeah, the big question is each of the variants, as it jumps from country to country and state to state, will the vaccines work against them? KPRC2 reporter Rochelle Turner is live at the U of H College of Medicine tonight with a closer look at that concern. Rochelle?
Well, Chris, experts here and at the Baylor College of Medicine say it's a little too early to determine how the vaccines will work against the variants. They say we must continue to do our part to stop the spread of the virus. There is growing concern surrounding the vaccines on the market and how well they will fight against 3 variants popping up across the world. The CDC says the United Kingdom identified a variant called B.1.1.7. In South Africa, another variant called B.1.351 emerged from B.1.1.7. And in Brazil, there's a variant called P.1.
The variant from South Africa and Brazil are variants of concern.
Dr. Hannah Al-Sali is an associate professor of molecular virology and microbiology at the Baylor College of Medicine. She says health experts are following the data and clinical trials from the locations to see how effective they are.
We have seen that the UK strain seems to be behaving a lot like the strain that is already circulating here in the States and worldwide.
As COVID-19 evolves, Dr. Bhavna Lal is an internal medicine physician in the Department of Clinical Sciences at the University of Houston College of Medicine. She says vaccines are an important tool in order to stop the spread.
We are in a race against time with these vaccines and COVID-19. If we do not vaccinate, these mutations will spread.
Both health experts say there is still much to cover about the variants and how they spread. Dr. El-Sali says it's important to follow the guidelines because there is a chance you can test positive for one of the variants even if you've already had COVID-19.
Reinfections can happen. We are seeing it even without the variants. Reinfections can happen. They are rare, but they do happen.
And doctors also say we could see more variants emerge as the pandemic progresses. They say, when is your opportunity to get the shot to consider it? Reporting live from the University of Houston, I'm Rochelle Turner, KPRC 2 News.